Hey, good morning, Facebook. This is Brittany coming to you live from the Seniors Blue Book. And this morning, I have a beautiful panel of ladies with me. Good morning, ladies.
Good morning.
How's everybody doing?
Good.
Good. Everybody looks good. We're all dressed. We're dressed to impress here on Zoom this morning. We want to welcome everybody who's watching to Seniors Blue Book Live. We're here to just help out and give some great resources. And today we're kind of honing in on the Manatee County market, just to kind of talk about some of those services if you are in need, whether you're an active senior, you're a caregiver, you're a professional looking for some resources for your clients. So without further ado, I'm going to introduce each person and then kind of get into some of these topics and resources. So we have Misty from Suncoast Behavioral Center. Good morning.
Good morning. How are you?
Great. Thanks for being here. And we have Christina Oikel from Brookdale, representing, let's just say Brookdale as a whole.
Brookdale.
And then we have Melissa Leadham. She is the owner of Secure Aging. Thanks for being here.
Thank you.
All right, so I'm going to actually just go ahead and hand this over to Misty. We all right now, I think this is a good starting point because we all, even before going live, I was discussing personally, we all need that support. We all need to know what some of those services are for our mental health. And right now it's more important than ever to be in a good spot, a good energy. So Misty, tell us a little bit about Suncoast and then maybe some tips or some services that you guys provide that can assist in Manatee County.
Sure. Thanks for the introduction. So Suncoast is a private acute inpatient psych facility. We have 60 beds. We serve all ages. So 20 of our beds are for children and adolescents, 20 are for adults. And then where we link up here, Brittany and everybody else that's part of Seniors Blue Book, is we have a mature adult program as well. So we have 20 beds for mature adults. That's an inpatient program. On that unit, we can accept a dementia diagnosis. Just the main thing there is that we have to be able to treat a behavior that's associated with the dementia diagnosis. So if it's dementia with aggression, dementia with assaultive behavior, dementia with depression, we can treat that behavior. And then in addition to our inpatient services, we also have outpatient services. We have a partial hospitalization program, which is Monday through Friday, 9 to 2:30. And we have an intensive outpatient program, which is Monday, Wednesday, Friday from 9 to 12. Right now, we're offering those programs via telehealth. So all of our patients, we accept patients, from Manatee County, but we also accept outside of county. And it's making it a lot easier for them to participate in our outpatient programming as well, because they can do so from the comfort of their own home or facility or, wherever they're at. And then the last part that we've been doing, and this is pandemic based, but also going to move forward, is we are doing Tele Assessments. So a lot of the facilities that we're working with, if they're not wanting to send a patient out, if they're not sure if they meet criteria for admission, we can do a Tele Assessment via Zoom. Our platform is HIPAA compliant, and we can actually do the Baker Act if need be, via Zoom, and really just kind of expedite that admission process so that somebody doesn't have to bring a resident to our facility for the assessment. And then if they don't meet criteria, they meet criteria for outpatient, go back home and then come back the next day to start the program. So it really just eliminates a lot of unnecessary steps and travel that we are, trying to make things as easy as we can on our patients at this time.
And if somebody is kind of outside that Manatee County area, I'm sure you serve people north and south of you. Just like the rest, actually, everybody on this panel, there's opportunity outside of Manatee County. What is the process for admission? Like, does somebody just give you guys a call? Do they have to get a doctor's, order to come into your facility, or how does that work?
Yeah, no, there's no order or referral necessary. Of course, we accept them if there is a physician or a medical professional that believes there's a need, we accept them. But our intake department operates as an emergency room, so it's 24/7. It's no cost assessments to the patients. We just do the level of care assessment and determine what level of care is most appropriate for the patient. So anybody can walk in, call, and the number for that is 941-251-5000, so 5,000. And that, again, 24/7, that's manned. So anytime there's a concern we can be called and we can schedule an assessment and make sure that we, get the next best appropriate level of care.
Awesome. Well, thanks for sharing.
Yeah.
And I'm going to move down to Christina. Christina, you work in the assisted living world, which is one of my favorites. So kind of help us understand, so one of the benefits to help pay for assisted living is the VA, is the veterans. So the veterans benefit, aid and attendance. Tell us a little bit about that and how somebody can obtain that.
Well, here's the great news is currently Brookdale as a whole, we work with a couple of different third-party companies that help assist seniors into finding out more about aid and attendance benefits. One of the companies is called Veterans Financial. We are actually doing a Zoom event with them next week. I'll give you details on that later. But right now, I just want to make sure you understand that to be eligible, there are so many different ways. This seminar is actually going to be really great because we're also pushing it towards third-party referral resources. There is a link on their website where you can pre-qualify a senior to find out if they're going to qualify for the aid and attendance benefits. So the way aid and attendance actually works, if you have someone who served in the military during specific war times, that doesn't mean that they had to have boots on the ground in Vietnam or they had to have boots on the ground in Korea. They just had to serve, be active military during those times. And if they fit all the other criteria, which I do believe on that website, there is a total of like 6 or 7 questions. And at the end of it, they'll tell you if it's pre-qualified. Now, mind you, based on the information that you are given. So if someone tells you something that's not necessarily true, then obviously they're not going to qualify. Like if somebody, owns an island off the coast of like Zimbabwe or something, that's not going to make the criteria. But there's actually another company that we've been utilizing quite a bit lately. It's called ElderLife Financials. What ElderLife Financial has been able to do for seniors, which this is something that I personally have worked with quite a lot. I have a special little soft spot for veterans in my heart. So I spend a lot of time helping veterans. And there are different types of veterans. When the World War II veterans were really searching for this, they are much more able to, or were much more able to do the processing without having to get a lot of outside help because they were able to deal with everything. What we've noticed is with the veterans who are the Korean veterans and the Vietnam veterans, for some of them, it's a little bit more of a struggle. I don't know if it has to do with stuff that happened during the war or whatever the case may be, but they need a little more hand-holding to get through the process. So, and not only that, but financially, they're not at the same level as the World War II vets were at, completely different era. So this ElderLife, what they've been able to do, I'm sure you're familiar with bridge loans. So they actually do 2 different types of bridge loans. One bridge loan is meant for seniors who are living in their homes that have been paid for, and there's equity in their home. If they don't have the finances and they need to sell their home in order to move into an assisted living or a senior related place to live, whether it's memory care, for some places, even independent living can be used for this based on how much care that they're physically going to be receiving. And what they can do is they can borrow the money. And what happens is they get whatever that VA benefit is for the people with the VA benefits, they will actually loan you the amount based on your VA promissory note that you get from the government. So when you get qualified, you receive a letter that states, hey, you've qualified for these benefits. Now you just have to go for the waiting game. Like you have to wait until the benefits show up. Well, that period of time, whether it be 3 months or 4 months or whatever, is the part that makes it really difficult for these Vietnam vets and Korean vets to be able to get into senior living because they get caught in this little catch-22. So what happens is they might have Social Security income of, let's say, $1,700, right? And they are eligible for benefits, and the benefits are at 1901. So obviously with those 2 incomes, they're able to afford senior living. However, that's all they have. There's no savings. So they have a hard time getting into the building because there's a community fee or whatever the fees are in the beginning. They can't make it in there. So then they can't collect their benefits. So in order to fix that catch-22, that's where ElderLife comes in, because they're able to use that promissory note to get them into a senior living community. And then when the VA benefits kick in, they're able to collect it all. So it's actually a really great situation. Brookdale, I don't know how many other companies do this, but Brookdale actually pays for the interest on these loans. So the money isn't coming from the senior, it's coming from Brookdale, the company itself. Not only that, but the actual amount that they have to pay on a monthly basis for the charge fees is minimal. It's no more than $20 a month. And then when they do get their VA benefits, they just have to pay back that note, and then they start getting the checks directly to them. So it really has helped quite a few veterans as of a whole right now, what I've seen. I mean, I personally have done at least 15 different these types of transactions with these loans, because that's the only way that they're able to have the money so they can afford to get into senior living. Listen, honestly, the veteran seniors that I've dealt with, they are living in deplorable conditions where they don't need to be that way. They served our country. We live under the blanket of freedom because of what they sacrificed for us. And a lot of them don't realize that they have this benefit sitting there waiting. They just need people to help them and to show them what's there. So that's what we're trying to do to make that a smoother transition so we can get these veterans the care that they need and they deserve. So that's my pitch on the VA.
That's awesome. Such great information. And I know from working with several clients and families in the past that this is a means of getting somebody, it's a difference of, like you said, being in home and not being able to be in a safe environment into a safe, and safety is the biggest thing, getting somebody into the arms of a community that can take great care of them. So
Right.
Thank you for sharing. And of course, again, you're with Brookdale. So Brookdale has a lot of senior living communities around our areas, Manatee County, Sarasota, Charlotte, all across the United States. So we'll put your information in the post too, in case people are looking for a community.
Thank you.
Absolutely. All right, Melissa Leadham from Secure Aging. Tell us about how a care manager, and especially on the financial side, is a huge component of what you guys do. Tell us how that can benefit somebody, especially right now as people are experiencing a lot of different isolation and families are not able to travel like maybe they were before to help them.
Sure. Yeah. Thanks, Brittany. Yeah. So at Secure Aging, we provide care management services, both on the financial care side as well as on the health advocacy side. And we're staffed with licensed professionals on our team. We've got formerly called geriatric care managers, but the new term used in the industry is aging life care specialists. And then we also have nurse care managers on our staff as well. My background, I focus heavily on the financial care management, and by training, I'm a CPA, and I also have extensive experience in fraud investigations. And so, that was way earlier in my career. So what we have seen during the pandemic, as Brittany has said, is, there is just sort of a heavy feeling of helplessness that is coming from out-of-state family members. And so, it is quite a difficult time, both for our seniors who are in communities which are locked down, but also for, seniors who are still living independently, maybe in a condo or even in a home. And, they either have no family members surviving them, or, their adult children or their closest family member lives out of state. And so, as you can imagine, we have taken many calls, since the lockdown and since the beginning of the pandemic, from out of state, some frantic, some more frantic than others, but mostly from out of state adult children. And so, to make it simple, what we like to say is, we essentially provide local feet on the ground to help keep family members safe if they're living independently, to help provide them with, the same dignity that they had if they weren't afraid to go out of the house. But really for adult children, we essentially are the adult daughter or the adult, child who is on site. And so, we've taken phone calls, anywhere from, could you please just go get my dad a milkshake and drop it off for him? Melissa, we live in Ohio. We're 3 siblings. Our parents are in their early 90s. They live independently in a condo in Manatee County. And, our dad fell and broke his hip and is in rehab, and our mom is at home alone. And she was paying the bills, and she's getting confused about, being able to pay the bills and kind of keep the house, the house, I say keep the lights on is what I call it. And so can you go over and kind of see what needs to get done? And so what we do in that situation, we kind of really take this team approach. And so the nurse care manager on my team would work directly with the rehab facility where, the husband who broke his hip is, and would help sort of relay information to the family around diagnosis and treatment, would check in regularly with the clinical staff, would do telephonic wellness checks because, of course, we can't go into many of these places. In that example with the wife who is now at home and is missing her husband, but is scared and concerned, and there's anxiety that's building up, we would then go on site, and I would start working with her to say, okay, what bills were you paying? Let's take a look at your checkbook. And so with that financial background, I'm able to come in and really, help alleviate, some of that concern. And we've got several team members who have, that financial background who can do that. So I would sit with her and help her write checks, help her make sure that, she's still maintaining the household. In situations where there's a power of attorney, like let's say one of these adult children is paying the bills, or should be paying the bills, we would then coordinate with them. And if they just don't have time to get that done, we would take care of that and then coordinate reporting back to them. So we kind of really serve as an extension of someone's hands, sort of like a project coordinator. We often say that we're kind of at the center of the hub, and we can connect to local resources. So like Misty and Christina on this call, they are perfect examples of resources, kind of spokes on the wheel of where we would be reaching out and coordinating locally. And that's the benefit of having, almost like a quarterback or a team captain, with boots on the ground. But we end up, what we have seen is a lot of families have really, and I think a lot of people have done this during the pandemic, have taken to heart the need to organize themselves from a legal document perspective. And so we have been getting a lot of phone calls from elder law attorneys where families are coming in and having their documents updated, or, they're finally getting that trust put in place that they needed to have put in place. But once that happens, there's then some confusion about, okay, now how do I get those assets into the trust? So once you form a trust, it's like having a framework of a house. You've got to almost, put the assets in or put the furniture into the house. So we've got also doing quite a bit of work where we're helping families organize themselves from a documents perspective on the financial side. So, kind of serving as an extra set of hands for the family between the elder law attorney. During tax time, we were quite busy, as you can imagine, running around getting signatures on taxes. And so, same thing. We sort of stand in between the CPA doing the taxes. Even though I'm a CPA, I do not do taxes. I don't like taxes, but I understand them. So I can explain them to families. And so we sort of step in the middle, and we get all the information to the CPA. The CPA prepares the tax return, sends the signature page back to us, and then we go, to the family or to the community, and then help facilitate getting that signed. And then I'll often answer questions from our clients about their taxes. So it's, it's quite a jack of all trades type of role, being a care manager, but we love it because, I am a daughter, so when I say, we play the role of an adult daughter, my parents are aging, and, this is just what we do. And so there are many, many of our clients, our shared clients, who don't have, anyone to do this, or they don't have family members here to do it. And we're more than happy to step in and help with that.
Awesome. So there's a couple things I want to hire you for. I've been craving a milkshake. number one. And then taxes. I mean, would you be willing to work me a deal to do my taxes, or just kidding?
About that, we've been doing lots of milkshakes at communities for birthdays, Brittany. So when it's your birthday, you tell me and we'll make sure we hook you up.
I hope that we're not in this situation, like when my birthday comes back around, because it's in May.
Oh, me too. Okay, fingers crossed.
So thank you so much. You guys
Right.
are that link. And again, everybody can kind of see how you guys are all connected, resources. We all need each other. We all need to be taking a client's individual situation and linking them to whatever they need in their journey. And like you said, a lot of these communities and facilities, or I should say all of them, still are under that you can't go in and you can't visit, whether it's your loved one or again professionally, but you're that link to give that peace of mind to that family who's in the other state, that you're keeping in touch, you're making sure mom or dad are doing fine at home as well. And it's amazing how you do what you do. I'll just say that.
Thank you. Thanks so much.
Absolutely. So that kind of wraps up our Manatee County support services. As I mentioned, that these wonderful companies and communities are not just here in Manatee County, but they're also in, like I know, for example, Melissa, you guys obviously are in Sarasota County as well.
Right.
So feel free to reach out wherever you are if you have any questions for any of our expert panelists. I'll put all their information in this post. And ladies, I just want to say thank you so much for providing all of this education and information for our viewers. And thank you for everything you're doing every day for our seniors and caregivers.
You bet.
All
Thanks,
right.
Brittany.
Brittany.
You're welcome. All right, everybody have a wonderful day.
You too.
Bye.